Because we are in the crossroad. We have been showing that we can produce results. We have been demonstrating that we can increase the coverage. And we have science evidence today which can show us that we can even reduce significantly the number of new infections if we put people early on treatment. But what we need is to sustain those results. What we need is to make sure that we build a new momentum which will help countries to own their own response. Because AIDS, even if we're calling for ending AIDS, we know that it will not happen tomorrow morning. But we need to redouble effort and make sure that this conference can come with a new voice of activism for sharing solidarity, sharing the burden, and bringing the mutual accountability, and making sure that global solidarity for people without voice will continue to be effective. And the basis, Africa 10 years ago were considered as a hopeless continent. Today we have 6-7% economic growth. So we need to talk about sharing the wealth. We need to talk about sharing responsibility. And that's what we have been doing as UNAIDS. We have been working closely with the government to bring the debate of sustainability and ownership. And we are seeing today that countries are reacting. 81 countries who increased by 50%, I said 50% their domestic resources to finance HIV response during the last 4 years, which is amazing. And we're seeing countries like China who decided now to pay completely for their AIDS response. It's the same for India, Russia, and Brazil, which were not happening. And that is what I think is a new narrative in the AIDS response. Is happening already in the developed world. Is happening in some developing countries like Botswana. Botswana, where we're all thinking that it will not even be in the map of Africa because infection rate was so high. Botswana is eliminating today the transmission. Swaziland is doing it. Namibia is doing it. We can do it.
Use condoms or not?
I think that is the most important element which has been the missing link in all our strategies. We need to really place the women and the young girls at the center of our approach. And we will not stop, like you said, the transmission if we don't link reproductive health and HIV. If we don't link this whole movement of engaging men also in a social transformation, which will help to give voice to women.